What's going on, everybody? Happy Thursday. This is your Legislation and Military Policy Director, Matthew Schwartzman, coming to you live from the Minuteman Memorial Building with an up-to-the-Minuteman legislative update on legislation that was actually just introduced today, in part due to ROA's advocacy efforts. As you may recall, in the March and April editions of the Reserve Voice newsletter, ROA spotlighted our joint efforts with the Commission Officers Association of the United States Public Health Service to provide for parity with a lot of service-earned benefits between the uniformed services and the armed forces, specifically the United States Public Health Service. We hosted a Uniformed Services Education Forum right here in the atrium at the Minuteman Memorial Building, striving to educate mission partners on the nature of service in the Public Health Service Ready Reserve, as well as on some of those key legislative initiatives. Just earlier today, Senator Tammy Duckworth introduced the Parity for the Public Health Service Ready Reserve Act, which includes many of the issues that were addressed at that Uniformed Services Education Forum and were a part of ROA's larger public policy portfolio for the 118th Congress. Specifically, this legislation codifies the structure of the United States Public Health Service Ready Reserve to enable access to benefits that are on par with the armed forces. It authorizes Ready Reserve personnel to have the same dual compensation and military leave rights as those in the armed forces, and it expands access to the TRICARE Reserve Select program and the post-9/11 GI Bill for these public health patriots. ROA thanks Senator Tammy Duckworth for her leadership and sponsorship of this important legislation, and also thanks our mission partners at the Commission Officers Association for their support as well. But the truth be told, the work is just getting started. ROA is now going to focus on our efforts on moving this legislation through the legislative process with finality to ensure that we can provide for parity between the Public Health Service and also the other armed forces as well. ROA is really excited at the opportunity to move this legislation through the process, and I'm really excited to be coming to you live with this Up to the Minuteman update. So thank you very much, everyone, for tuning in, and I'm looking forward to coming to you live again with another Up to the Minuteman update soon.